Hi, welcome to the Move to Mobility video series. My name's Jeanette Kochman and I'm an outpatient physical therapist. I work for Lifeline Therapy and I'm the facility director at the Forest Hills location. Today we want to help you feel more comfortable and informed as you consider total hip or total knee joint replacement surgery. We want to help you understand what you can expect from outpatient physical therapy. We're going to be going over some of the treatments, talking about the things that we'll be doing to get you started and setting goals. We'll be going through some of the basic exercises and talking about some of the factors that influence your outcomes and your success with physical therapy. At your first visit to the clinic, you can expect to meet one-on-one with a therapist. The therapist will be doing a past medical history review with you, a vital sign assessment if that's indicated. They'll be administering some questionnaires to you so we can get an idea for your current functional abilities and your pain levels. The therapist will be assessing your range of motion and your strength and doing some short little movement tests. And also, of course, we'll be answering any questions that you might have. We'll be using the information from your initial evaluation to help develop your plan of care. We'll be determining the number of visits that we think that you're going to need in therapy, as well as the frequency that we would recommend you attend for visits. We'll also be using this information to help with setting appropriate goals. We always want your input with setting goals. We want to know what's important to you, and our goal is to help you achieve that. We'll have some other goals of our own with regards to your range of motion, meaning how much your knee can bend and straighten, and with regards to helping you progress off an assistive device, get your walking pattern as normal as possible, get you going up and down the stairs normally, and get you rising from a chair using both legs equally. In outpatient physical therapy, there are three main components to your treatment plan. The first is gait and function. The second is manual therapy, and that includes things like mobilizations for your incision or your scar, passive stretching to improve your flexibility, and joint mobilization techniques to improve your range of motion. And the third component is the exercise component to address strength and range of motion. Many of the exercises that we're going to be showing you today are appropriate for both total hip and total knee replacements. There are a few of them that are specific to one or the other. We're going to start by showing you some exercises addressing the first component of gait and function, and Jen's going to be demonstrating the exercises. The first exercise is called a forward step up. Place your foot on the stair, come up and bring the other foot next to it, and return down to the floor. Good. Now turn sideways, Jen. The next one is called a lateral step up, and bring this foot out a little bit further here. And you're going to be bringing that foot up onto the step in a sideways motion and then returning back down to the floor. Okay. The next exercise is called a mini squat. So face forward here, Jen. Feet shoulder width apart. You're going to be bending back as if you're going to sit into a chair. So bring your hips back, and then on the way up, squeeze your thigh muscles and squeeze your buttock muscles. Don't let your knees come forward. Stick your bottom back a little bit more. That's better. The next exercise is called terminal knee extension. We're going to be using a resistance band. You can put your leg inside the band, Jim. Okay. Stand with your feet, next to one another. And you're going to relax your knee here, let it bend a little, and then you're going to squeeze this muscle to push your knee back straight and stretch against the band, and then relax and let it bend. And squeeze here. Relax and let it bend, and squeeze here. Good. Okay, take your leg out of here. The next exercise is called side stepping. So you're going to face forward, keep your hips and your toes square ahead, and you're going to step sideways and move across the room. 3 or 4 steps in that direction, and then you'll come back the other way. Okay. The next exercise is just a single leg balance. You can have your hand on the rail for a little support if you need to, but you're just going to pick one foot up off the ground and try to stabilize and balance on that one leg. Back down. Another exercise, standing on one foot. You're going to push up on your tippy toe and back down. That's called a single leg calf raise. And then another piece of equipment that we might use to address the gait and function component is the treadmill. We can use the treadmill to help promote a normal walking pattern and to help improve the speed at which you're walking. Another important exercise to improve your function is called a sit to stand. So you're going to scooch out to the edge of your seating surface, space your feet apart a little wider. You can, if you're a beginner, you can start pushing from the mat table if necessary. The goal is to progress to being able to do this with your arms across your chest. And you're going to come forward and stand up, getting your hips and knees fully straightened out. And then you're going to reverse that and sit back down with control. This next set of exercises are basic strengthening exercises. So Jen, you can bend your knee on this leg. Good. We're going to keep this leg straight. Put your ankle back, tighten this muscle. Raise this leg up about 6 to 8 inches, little pause, and then very slowly lower it back down to the mat. This is called a straight leg raise. Good. You can turn onto your side. Bend the bottom knee a little. This leg is straight. Keep your hips level here. And you're going to raise this leg up towards the ceiling. Little pause, and then lower with control. This exercise is called side lying hip abduction. Okay, you can turn over on your stomach. And you're going to keep this leg straight and lift it up off the mat table, straight up towards the ceiling and back down. And this exercise is called prone hip extension. For all of these exercises, your therapist will be determining the appropriate number of repetitions and sets, as well as if adding resistance is indicated. Okay, and then staying on your stomach, you're going to bend your knee and bring your heel towards your buttocks, and then return back down with control. And this exercise is called prone knee flexion. Okay, you can turn over on your back and have you bend both of your knees, and you're going to lift your hips up in the air, pause, 1 to 2 count at the peak, and then lower down with control. And this exercise is called a bridge. Good. I'm going to get a bolster here for the last exercise that we're going to demonstrate. I'm going to put this underneath your knees. Good. Relax your legs down over the roll. And you're going to straighten up your knee, little pause at the peak, and then controlled lower back down to the table. And this exercise is called a short arc quad. And sometimes after surgery, this muscle has a hard time firing, or it's very, very weak. The swelling in your knee can cause it to be weak. So if you don't have enough strength in this muscle to be able to lift your heel off the table, then we will be using something in the clinic called electrical stimulation. We use the electrodes and we place them on the appropriate muscle group. And then we use a current to help teach the muscle how to work again and to help strengthen it. The next set of exercises fall into the range of motion component. This is called a recumbent stepper. And go ahead, Jen, push and pull. And this is used to help bend the knee and bend the hip. There are also adjustable resistance levels on here so that we can use this for strengthening as well. Okay, another piece of equipment that we use is a recumbent bicycle. If you don't have enough motion at your hip or your knee to complete a revolution, we can start you out just by having you pedal back and forth in arcs. And then when you're able, the goal is to pedal a full revolution. Go all the way around. Another exercise for a range of motion is called a knee flexion stretch. So Jen, you're going to put your foot up on the second step and then you're going to lean forward. And you'll hold that for a set amount of time as determined by your therapist, and then come back out of the stretch. And move forward again. There are other positions to work on this knee flexion stretch, so your therapist may teach you to do this in a seated position or lying down on your back with your foot up against a wall. This next exercise is called a prone hang. You're going to be lying on your stomach with your legs hanging off the end of a bed or a treatment table. And for some patients, just being in this position and letting gravity pull on that leg creates a big stretch. If it doesn't, the therapist may add variable amounts of weight to the ankle to increase the stretch further. Our goal is to help you have a successful outcome. You play a big role in that. We need you to come consistently to all of your appointments as scheduled, and we need you to be compliant with your home exercise prescription. Some of these exercises we demonstrated today may look easy, but it's important to come into the clinic so you have a therapist skillfully progressing the exercises appropriately. We monitor your symptoms and we use other factors to help to determine when it's appropriate to advance you to the next level. When you're finished with outpatient therapy, we'll be providing you with a home exercise program as well as general advice on physical activity levels and healthy lifestyle choices. And if you're somebody that works out at a gym, we can give you some recommendations regarding return to the gym and what things are safe to utilize there. If you still have any questions about attending outpatient physical therapy after a hip or knee joint replacement, please feel free to call us at Lifeline Therapy. And thanks for watching this episode of Move to Mobility.